Welcome back to Hardball. Members of Congress see and hear a lot of anger back in their districts these days about health care. It's as extreme as death threats for some members, and other places just anger and incivility. Last Wednesday, for example, at a senior center up in Manchester, New Hampshire, Democratic Congressman Paul Hodes, who's running for the Senate, was rebuffed by a constituent when he tried to shake her hand. She said, "I don't want to shake your hand. You voted for health care, so just go away." And this past Monday night, the shouting started again at Congresswoman Debbie Wasserman Schultz's town hall meeting down in Fort Lauderdale. Let's listen and watch.
Historic healthcare summit led by President Obama to review the details of the healthcare reform legislation. So, excuse me. I'm going to ask everybody to continue to be respectful.
Be respectful to us when you lie.
Congresswoman, who gave you the right or the authority to determine whether or not I have to purchase health care?
So what's behind this anger, and can Democrats do anything to change people's minds? Both Congressman Hodes and Congresswoman Wasserman Schultz join us now. Congresswoman, let me ask you this question. It seems to be the issue that's grabbing people right now is not the cost or the fiscal issues or all the complicated issues of medical care, but this libertarian argument you're beginning to hear, I don't want to buy health insurance, you can't make me.
Well, at my town hall, I did get that question, you know, the what gives you the right to force me to have health care question. And what I explained, and a lot of people appreciated this explanation, was that we did not require in this legislation Americans to have health care. What we did was we established a different treatment via your tax return, just like the difference between married people and unmarried people, or people who have children and don't, or homeowners and renters. So if you choose not to have health care, you can do that. But you just need to understand that you're going to be treated differently on your tax return at the end of the year, and you're going to have to, you'll be assessed differently than you would have if you carry health care. So it was a pretty simple explanation, and a lot of people appreciated it. But unfortunately, you know, the segment that the clip you just showed from my town hall, you know, all of those clips were taken by opponents of reform. They don't really show the fact that the overwhelming majority of people that showed up to my town hall were supporters of healthcare reform, supporters of me and of President Obama, and were very enthusiastic. And I got a chance to talk to them, my constituents, about the fact that we closed the Medicare Part D donut hole and clear up a lot of their questions, and highlight the fact that we literally changed the healthcare system with this with the president's signature from a sick care system to a prevention and wellness system, and took the insurance companies out of the driver's seat and put patients and doctors there where they belong.
Let's bring in Congressman Hodes up in New Hampshire. We haven't had you on for a while, sir. Thank you for joining us. This woman gave you, sir, the rebuff when you wanted to shake her hand the other day. Is that new for you to have that kind of anger?
Well, Chris, this is New Hampshire. We have a lot of independent thinkers in New Hampshire. What happened at the Cashin Senior Center was I had a great time. There were a table of about a dozen ladies who were eating lunch. Two of them didn't like the health care bill and didn't want to shake my hand. The other 10 said, "Come on, honey, sit down. Let's have lunch. We want to shake your hand." And we had a great time at the Senior Center. So there were a couple who weren't happy, and an awful lot of people who were thanking me, and we're especially interested to hear that this year we're going to start closing the donut hole for seniors.
Well, let me ask you, Congressman, is this a squeaky wheel situation where the people that don't like it are getting all the noise and getting all the reaction from the media? Because obviously, you know, we don't say a great day out on 95 last night, there were no accidents. We cover the accidents. I mean, that's just what news is. I mean, it's a sad fact. We're not going to say, God, you know, everything went great the other day, or you say 5 people got murdered last night. Well, so, I mean, that's the fact of news coverage. We are going to cover the anger factor. Are you saying it's not representative, however? Are you saying that?
What I'm saying, Chris, is it's certainly not representative of my experience this week. I've been out talking about jobs and revitalizing the middle class, and health care reform is a jobs bill, especially for small business. And people have been thanking me when I tell them that kids for 19 and under are going to not be denied health insurance for pre-existing conditions, that seniors were going to start closing the donut hole, and that for small businesses, this means tax credits now to help them help pay for health insurance insurance for their employees. Folks are thanking me. And what I've got is, so I had 2 ladies who didn't want to shake my hand. We did a public town hall in Nashua. It was advertised all over. It was advertised on statewide television, in the newspapers. I had one guy outside with a sign saying, "It's my money," and inside I had a crowd that gave me a standing ovation when I walked in and wanted to know some details and talk about jobs.
Okay, let me go to
Chris,
Congresswoman Schultz. I mean, I just want to know about this thing. A couple things mystify me. First of all, if we're closing the donut hole, which means people who rely on drugs, pharmaceuticals, will get a pretty good deal now. They'll get basically drugs as expensive as they might get. They won't get cut off at a certain level. That's a very good thing for people as they get older, because you rely more and more on pharmaceuticals, and we all know that, and that's better than not taking them. We all know that. Why are they complaining, and why are people who are already on Medicare, which is a government program that they've kicked into during their working years, why are they against the government role per se? That's what surprises me. They benefit from a government role per se. Why do these people say, why can't the government stay out of health care? What are they talking about? It's inconsistent.
Well, the senior citizens that I represent, and obviously representing a district in South Florida, I represent a large number of them. When we have a chance to explain to them and cut through the rude bullies that are essentially trying to take over these meetings, and the noise like that you just described that is really getting over-covered in proportion to what's really happening, when we have a chance to explain to seniors that they get a $250 check this year when they fall in the donut hole, that next year there'll be a 50% cut on name-brand drugs when they fall in the donut hole, and over the next 10 years it'll be completely closed, that we're adding 9 years of solvency to Medicare, that we're going to make sure that they can have an annual wellness exam, which most seniors don't go to, can't have right now because they can't afford the co-pays and the deductibles. When we get to explain that, then seniors understand and support the bill. The rude bullies in the Tea Party, some of whom actually came to my town hall meeting, Chris, the other night. And by the way, Paul, I also got a standing ovation at the beginning and at the end. 80% of the room was for reform. But Chris, I mean, one guy yelled out to a woman who was standing up in support of reform. He yelled out "good" when she talked about how she had been brain injured on the job with a lead ball, and that's why she had forgotten her question and asked for another opportunity to ask it. Another person in the courtyard screamed out that God punished me and gave me breast cancer because I supported health care reform. So it's just, I mean, the vitriol and the venom. These people aren't interested in working together and having a civil discussion. They're interested in winning. And that's not what this is all about. We should all come together.
Well, we'll keep a lookout for that person who took the pictures of your last meeting. That was the shakiest hand I've ever seen in television. Anyway, thank you, Congressman Paul Hodes and Congresswoman Debbie Wasserman Schultz.